what we do at Pinnacle is we use autologous biologics. It's true or false. You've been healing your wounds and your cuts and your injuries since you were a kid, right? Typically, that's pretty efficient. Well, you have the ability to heal yourself in you, and we can take that and we can magnify it. And the idea is that we take your blood or your bone marrow, and we take a certain type of cell, and we use centrifuge, and we concentrate that type of cell, and then using ultrasound, we inject it exactly into the place where we want to deliver it. In the case of blood, it's the platelet, right? So what we want there is we want the platelet. The platelet is actually a fragment of a cell that's in your circulating blood. And in your typical circulating blood, you have about 130,000 of them per high power field, like milliliters, say. Well, we want to magnify that to 5 or 10 times. And then we inject that into an area, and those cells really stay there. They release materials that are very potent anti-inflammatories. They release proteins, enzymes that can help kind of remodel tissue and make it healthier. And the goal is with biologics therapy to make that tissue healthier and to heal injury. And a lot of times we can heal sort of chronic inflammation. As we age, we get chronic inflammation in our tendons. Sometimes these treatments can reset that sort of biologic clock. And we use PRP very commonly for all different types of injuries. It's very effective in arthritic joints. It works well for tendinitis. It works well for some types of tendon tears. It can heal tendon tears. An even more powerful modality is what we call bone marrow aspirate concentrate. So that is actually using your stem cells, if you will. They're called mesenchymal stem cells. We have certain types of cells in our bone marrow that can go out into your bloodstream or to a certain part of your body and become other types of cells. And the idea is that we harvest those cells, we isolate them, we concentrate them, and then we inject them. And those can be very, very effective in the treatment of arthritis. It's a neat procedure that we've got really good at. We take an ultrasound. There's two good places to get bone marrow in the body where you have a lot of these cells, a high concentration. One is in your sternum, right here in your chest, and the other one is in your pelvis. And nobody will let us put a needle in their sternum. We numb up an area of your pelvis, and then we put a small needle in there. We suck out it's usually about 60 milliliters of bone marrow to treat a joint. We've developed a technique at Pinnacle that's a modification of some of the best techniques that I was able to learn. And we treat that bone marrow and isolate it and concentrate it, and we inject it typically into an arthritic joint. It also works really well for things like rotator cuff tears that are not all the way through the tendon, elbow injuries, a lot of those things.